Everybody, we'd like to get started now if we can. We have a schedule to stick to, if possible, so that we don't get you out of here late. And our next panel is going to be led by Jomella Watson-Thompson. She's an associate professor of applied behavioral science, associate director at the Work Group for Community Health and Development at the University of Kansas, and a member of the Planning Committee. And I'm going to let Jomella take it from here.
Thank you. We have the fun of being the panel after lunch, so we will try to make it engaging for you. So I do thank you for the opportunity to serve as a moderator for this panel session. And at the Work Group for Community Health and Development, a lot of the work that I do is in the areas of violence prevention, adolescent substance abuse prevention, and basic positive youth development and neighborhood development. And I have the great opportunity to work collaboratively with community partners to learn with them through participatory approaches. So the topic that we're going to discuss today on community engagement and partnerships is something that I think all of us very highly value. And so with that, what we really want to explore is how do we bring groups of people together to be able to support change in communities and systems that will contribute to population level or community level improvements in health and development outcomes. And what we do know is that a one-size-fits-all approach or a cookie-cutter approach to engagement doesn't work. We have to take into account the context, including the history, the experiences, and the opportunities, or the lack thereof, of those, both the groups as well as the individuals that we are working with to engage. So we do a lot of assessment, right? I think an aspect that we need to be assessing is just that in itself, community participation and community engagement, so that we understand and can do it in ways that are genuine and equitable. And so with that, our panel is really going to explore this concept of how do we build a culture of health through partnerships that support community engagement. And we are very fortunate to have three panelists. All three were three of the 7 2016 Robert Wood Johnson Foundation Culture of Health Prize winners. So we're glad that they're joining us on today. And Shelton is snapping, so he wants us to snap for that a little bit. There we go. So thank you, Shelton. And so our first panelist is Yesenia Castro with the Mid-Columbia Health Equity Advocates Coalition Coordinator. That's her role. And she serves in the Columbia Gorge region of Oregon and Washington. Our second panelist, who is a snapper, is Shelton McElroy. And he is a project manager for Metro United Way and Change Makers Leadership Instructor at Jefferson County Technical College in Louisville, Kentucky. And then our third panelist, Stephanie Coe, is the Special Assistant to the President at Beyond Housing in North St. Louis, Missouri. So with that, we're going to be a little bit structured as we go across our panel and our speakers. So first, they're going to just give us a little bit of context to tell us about their work, with whom they partner, as well as what they've identified to be most meaningful or some of their proudest accomplishments. And within that, they'll provide us with some context in regards to the resources and the capacities that they have identified that are key to sustain in the community. So with that, I'm going to give it to Yesenia, who's going to get us started. Thank you.